while Kelly works with Kathy to get her audio working, I'll start with just introducing myself and the panel. Thank you everyone for dialing in. So I'm the Strategic Marketing Manager at Nextern. At Nextern, we enable medical device companies and entrepreneurs through full spectrum product development and vertically integrated manufacturing. Today, we're gathering to discuss how digital health is transforming healthcare by bringing innovative products to the point of care and into our homes. So our panelists are some of the thought leaders in this space. Lydia is the CEO of Kio. Kio is a musculoskeletal digital health solution that partners with payers and employers to deliver musculoskeletal therapy, improving outcomes and reducing costs. Maryam is the CEO of iSono. They are a company transforming the breast cancer screening experience by developing a 3D ultrasound scanner paired with artificial intelligence to detect breast cancer at the point of care. Lonny Stormo is the CEO of Pops Diabetes Care. Pops Diabetes is a discrete diabetes management system that has revolutionized the patient experience. They provide a miniaturized testing system and a virtual care management program. And Kathy Toon is the founder and managing director of Fourth Element Capital, a medtech investing firm, and she also serves as CFO and COO at Odonata Health. Odonata is seeking to improve the fetal and maternal health outcomes through their innovative monitoring system. So we're going to just kind of dive right in because we have a lot of interesting things to discuss. So a driving force of the trend towards digitizing healthcare is the fact that it can make healthcare more affordable. Lydia, can you speak to how a company like Kio is making the case that they're saving money for the payer or employer and also for the patient?
Absolutely. So especially for musculoskeletal issues, one of the big challenges is that it is all too often the fact that patients are prescribed diagnostics and treatments for musculoskeletal issues that are not supported by clinical practice guidelines, are often expensive, and are often unsuccessful in alleviating the pain. Opioids, MRIs, and surgeries are great examples specific to back pain. So the value proposition is pretty simple by using, when appropriate, a digital solution that is immediately accessible and guides members or patients through a proven evidence-based care program. Kio helps patients reduce pain, improve functions, and then avoid unnecessary and expensive treatments. But your question is really great, Anna, and it's how do we actually make that case that we save money to our health plan clients and to our employer clients? And the answer is that we've proven it using claims data. So Kio has taken the time to do multiple longitudinal studies with our health plan clients, looking at their claims data to determine the impact of Kio on medical and pharmacy utilization and cost as compared to a control group. And what we've seen looking at this claims data is that Kio provides our clients with a 3 to 5x return on investment within year one, which is really a tremendous savings. So a couple examples are one health plan client saving 64% in low back pain related medical spend. Another recent one we just finished saving 72% in Kio participants as compared to their regular book of business. And then the other really important thing that you mentioned is saving money for patients. So for the member of the health plan or the employee of the employer. And when you look at healthcare costs and the shift of burden in healthcare costs to the consumer, right, to people, it really is unsustainable. Particularly when you're looking at the out-of-pocket costs, deductibles, co-pays, et cetera. Really a significant burden on families. And Kio qualifies as preventative care. So we are offered at first dollar coverage by our health plan and employer clients to their members and employees. So that means no copay, no deductible, 100% coverage, and no time taken off work to go visit a practitioner. So that results in really significant savings for people as well. We've got a testimonial that I really love from a member saying, I spent thousands of dollars out of pocket unsuccessfully treating my pain, then found Keo and my pain is gone and it cost me nothing. So that is a win-win-win.
For sure. I think the fact that you guys are covered within preventative care, that's super interesting and something I hadn't really thought about when it comes to digital health. So another, critical piece driving the transformation of healthcare is the increase of accessibility. So Maryam, your product makes it possible through AI and ultrasound to perform breast cancer screening at the point of care. Why is that so important? And specifically to the U.S. market, why is bringing healthcare to the point of health solutions to the point of care important?
Yeah, sure. So today's breast cancer screening is kind of a one solution for everyone. It's, every 2 years for women over 50 do a mammogram, but over half of women have dense breasts and they need an alternative solution like an ultrasound or MRI, and it's often not available to them or accessible to them. They have to, even with mammogram, there are women even within US that they have to get on a plane or drive hours to get to a radiology center or a hospital that they can do breast cancer screening. And there's data that there is a sharp drop-off point, after the first mammogram. A lot of women don't go back to do their follow-up mammogram. So that shows that it's lack of access and convenience. So what our system does, our platform does, is with the automation of ultrasound allows our system to be used in settings where no specialist is available. For example, in an OBGYN's office, in a primary care's office, and even at home in the future. So that separates, the need for specialists being present and automatically accessible. It can be done at your local pharmacy, and then what machine learning and AI does is helps with, referring, doing kind of the first pass on diagnosis and deciding which patients needs to be referred for follow-up, diagnosis and follow-up recommendations. So, separating this, image acquisition to point of care or home from diagnosis helps bringing it closer to the patient. So what we call is closer to consumer, either, your local pharmacy or at your home. So.
Yeah, and I think it's very relevant to rural America as COVID is impacting those hospital systems. We might have long-term effects of that, and enabling remote or point of care screenings will be essential in handling that. So I'm really excited for your product to hit the market. Lonny, your company is very patient-centric with the motto, own your life. Can you speak to how digital health is focusing on the patient experience and why you believe this is the future of healthcare?
Yeah, absolutely. And the first thing I would talk about is in healthcare, I think we need to start thinking more often from an experience perspective, we've even saying patient experience. I personally believe that none of us strive to be a patient. So why do we deem everybody that's got any condition, which would make basically 100% of patients, calling them patients? And so we actually don't use the word patient in our company. We basically talk about people, we talk about consumers, because that's who we are. And that's what we really strive to be while we're dealing with these conditions that we have to deal with. And so thinking about, the condition that the person's dealing with through their eyes, I think is where healthcare really needs to start, and especially digital healthcare. Right? In digital healthcare, we're often, not all digital healthcare, but often the digital healthcare solutions like ours are putting technology in people's hands to allow them to deal with whatever their condition might be. And so we need to think about what it looks like from their eyes. And too often we continue to hold on to the traditional healthcare model and we say, how do we take care of this patient? Well, this person doesn't want to be taken care of. I want to take care of myself using digital health. And so how do we do that? And if we can start thinking about that from a different perspective, I think that's important. I kind of look back all the way to, when I remembered when in my days at my previous company where it started to be that people were starting to do searches to find out what brand of pacemaker they wanted to get. And telling doctors, I want this kind of brand of pacemaker. And as soon as those kinds of things started to become real, all of us as individuals, I guarantee, when we hear about a symptom or we hear about something that our family is going through, the first thing we do is we get on and search, and we become motivated around knowing how to deal with that. And that search engine has become so easy for us to use, or our phones have become so easy to use, or shopping on Amazon has become so easy to use. That's what people expect in the experience for healthcare too. And that's where we haven't gotten to yet. And so I think that's what our biggest healthcare challenges in digital healthcare is, creating the experience that matches those types of consumer experiences.
Yeah, I couldn't agree more. So Kathy, in a different light, Odonata is focused on providing data to the physician so that they're armed with that critical data needed to intervene at the right time. What should go into a digital health company's decision about data, such as how the patient receives the information, how the physician receives the information?
Sure. Can you hear me all right? Yep.
Yes.
So we're working very hard on that question right as we speak. That is actually one of the critical aspects of what we are doing and what any digital health company does. If you try, I think as we all probably know, if you try to change people's mode of working, you are going to have a very difficult time with adoption. And so we're trying to make sure as we go about this, we speak to enough people, all the constituents. We hired a consultant to do this, to reach out to all the various constituents in the picture so that we can understand how do they work today? So what's your workflow, or what's your care flow? And how would you want to work in the future? And typically they're not going to want to change much from what they do today. So how do you then kind of seamlessly slip into their stream of how they work? So Epic integration, so the electronic medical record integration is key to that, of course. The patient, so we're developing all, I think Lonny probably has done the same. So, we got to integrate with the phone. We have to, whatever type of phone they have. So Android or iOS, we have to integrate with the hospital systems and the electronic medical records. And so it's a lot of moving parts. And I will tell you the analysis of needs here has, rather than if you were saying doing a surgical tool where you ask the doctor, surgeon, what do you need? We have asked probably 10 constituents, what do you need? We have user profiles across the spectrum. And it's pretty, so it's pretty intense. We have a pretty big team working on it, not full time, but great consultants who have done this many times. And it's and it's a work in progress. I think it probably will be, just try to always make it better.
Yeah, for sure. I think that's one of the big challenges of digital health companies. Try to integrate with physicians and an existing system that doesn't really currently integrate with that super well. So I think it'll be very interesting to see how Odonata tackles that challenge. So I'd like to kind of pivot and start talking about what's on everyone's mind right now, which is COVID-19. And how your guys' individual companies are tackling this. So Lydia, as a digital health tool that guides patients through individualized evidence-based care programs on their smartphones, can you speak to how COVID-19 is shifting musculoskeletal care? And what do you think the long-lasting impacts will be?
Of course. So I'll talk first just quickly about the short-term impact and shift, and then kind of what I see happening in the future. So in the short term, people at the worst cases don't have access to preventative or non-urgent care. And regardless, they are putting off care. So there was a recent report out by the CDC showing that 41% of Americans are postponing care, right? Not seeking medical attention. And if you're looking at musculoskeletal, This is during a time when musculoskeletal pain is actually increasing, both because you're doing your work on your sofa at home, so you have bad ergonomics, you have lessened activity, and you have stress, and stress is very significantly linked to musculoskeletal pain. So you have less access to care at a time when your pain is worse. And the healthcare system has responded in various ways. Healthcare providers and payers have facilitated, for example, use of tele-PT with their practitioners. And health plans and employers have accelerated adoption of digital-first solutions. So solutions like KEO to be able to provide their members with effective and safe care in the safety of their home, right, in a convenient way. And, you know, the interesting thing with musculoskeletal is similar to the 80s, for example. The vast majority of people with musculoskeletal issues are appropriate for digital care. So at KEO, for example, we'll do a screening to look at medical risks, behavioral health risks. Is KEO an appropriate solution for you? And 80% of people completing our screening are appropriate for KEO. So really, we are accessible to the vast majority of people. We will never replace brick and mortar practitioners. There are people who absolutely are going to need to go in and see a practitioner, but we can assist in access to care issues in times of need like this by taking the majority of people and enabling those people who really do need access, better access, and enabling practitioners to operate at the top of their licensure. Kind of longer term then, I believe that the pandemic is transformative in digital therapeutics in a really similar way to how we've seen as a watershed moment in telehealth. So payers, so health insurers, employers really realize that digital first solutions are not just a nice to have, but a necessity for competitive advantage. And this is really for two different reasons. One is the cost savings, right? So we have proven that digital solutions are significantly more cost effective than traditional care in many instances. So delivering great outcomes at lower cost. And the second refers right into what Lonny was just talking about, and it's consumer demand, because consumers may have tried a digital solution for the first time because of access issues or because of safety issues, but then they're hooked on the convenience. You know, we deliver immediate access to care that is individualized to you, and you can use anywhere, anytime. It's personalized to you. We fit it into your schedule and we adapt it to the way you want to engage with us and empower you in your care, exactly what Lonny was just saying. And that really is transformative, and people are going to demand that more and more and more. And so these solutions, I'm convinced that we will see continued accelerated adoption of digital solutions. And we see that validated in the market interest, right? That market activation, market interest has been validated by heightened investment interest and heightened M&A interest in digital MSK, digital diabetes, digital behavioral health, the spectrum of digital solutions. I also think that we're going to see increased integration of digital solutions across the continuum of care. So a little bit what Kathy was speaking about, a better integration, and good example of that would be the way that we are currently integrating with utilization management or prior authorization processes with some of our plan partners, but just really putting digital solutions in from high upstream all the way across the care continuum. So I think we'll see that continue to develop as well.
I would agree. And even when you look at specifically musculoskeletal care, the integration from your general practitioner to your physical therapist and so on, I think we'll see post-COVID era some more of that. So Kathy, when we were talking before the panel, you mentioned that Odonata has made somewhat of a pivot to how they're prioritizing their product development. Can you speak to that and this long-lasting impact COVID-19 will have on OBGYN care? Oh, you're on mute.
So Odonata's product is, it's a monitoring, they have technologies, but the key one is a monitoring technology for prenatal health to be used in, in the prenatal months, but also to be used in the labor and delivery suite. And it utilizes artificial intelligence to be able to sort out all the noise and the mother's heart rate and everything else from the baby, which has a very, very small signal. And then there will be additional follow-on AI that relates to decision support for the clinicians in these various places. So that's the underlying, and then ultimately there's a system of care, so that then on the telehealth side, especially, you can provide a technology-enabled visit in the home, meaning you've got to get biometrics for these visits, and in order to get biometrics, you can't just do a video call like this, like you might be able to do for a cold. You've got to do a video call that has biometrics in the visit. So in order to get those biometrics, you need technologies to acquire them and send them forward to the clinic. So that's what our system is about, trying to capture all that and send it forward and enable that visit. And so what we were initially focused on was labor and delivery. It's the same core product, the rate monitor for the baby, but and our thesis was you had to prove to the physicians that it worked. This is a very, very this is a critical life moment, right? You have to prove that it works for these physicians and verify it, validate it, get clinical data, all the things that healthcare technologies need to do to be adopted, and then go eventually to home. So that was our thought process: go clinic, go hospital, validate, go home. Once the technology was validated, I've been saying, and I think maybe it's a little less true than it has been, but I've been saying that during COVID in the spring and summer, the advancement of technology utilization and adoption in healthcare moved forward by 5 to 7 years in a matter of 5 to 7 months, which is an unprecedented situation in healthcare. They don't move that fast ever. So with all of that, then as we talked again to the same doctors that we talked to before about first, it became very clear that they were actually now open-minded to technologies in home for this indication. So I think it was that for us, the pivot relates to the physician community and payers shifting their mindset quickly, far more quickly than we would ever have imagined, toward this acceptance, and therefore what was to be a futuristic product then becomes the first product, given the dynamics of the market that we see are changing.
Yeah, I think that's the positive outlook from COVID is there is going to be positive transformation in OBGYN care. So Lonny, diabetes is listed as a risk factor for COVID-19. Can you speak to how this has impacted your business and how it has impacted your consumers as well?
Yeah, unfortunately, diabetes is unfairly impacted by a condition like COVID, because uncontrolled diabetes can affect your immune system. And so there's data, all kinds of different data out there, but one as an example would be in the ICU, there's 4 times more proportion of people in the ICU with diabetes versus how many people have diabetes in the general population. So it gives you an indication. But I think the really important piece there that we always talk about is it isn't diabetes itself that compromises your immune system. It's uncontrolled diabetes that compromises your immune system. And really what we need to do now more than ever is have people actually take care of themselves and control their diabetes to reduce the risk that they have from the virus. And just like Lydia said, unfortunately, exactly the opposite is happening today. People are not going to the doctor. There's data about the number of new people that are starting drug and insulin therapies for diabetes in 2020 is dramatically below the same numbers in 2019. And that isn't because all of a sudden we have a lot less diabetes. It's because people just aren't going to the doctor. They're not being diagnosed with diabetes. And even if they're diagnosed, they're not taking care of it. They're not being issued prescriptions for insulin, et cetera, which means we just have more uncontrolled diabetes. So it's kind of a building problem. And I actually think this is why digital health is, perfect for this particular situation. So again, just like, others talked about, now that you have digital health solutions, people can start to take more control of what they're doing. So as an example, what we did is, so our product is Mina, an AI virtual coach combined with a glucose monitor to allow people to manage their diabetes more in their own hands. And we obviously aren't out to everybody in the country. And so what we did when COVID hit was we said, well, let's make Mina available online to do coaching for people who aren't even subscribed to our system. And, whether it's Mina or whether it's something else from ADA or JDRF or whoever it might be, I think what we want is for digital health to have an impact on these people, even if they're not daring to go into the clinic, or even if they're not, trying to do the normal things they would do for healthcare. And that's why I also think, like Lydia said, it's not going back. I mean, the horse is out of the barn and there's no putting that horse back. People are going to see, at least if they get the consumer experience that we all want them to have, that this is an easier way to do it. And going backwards is not going to happen, in my opinion.
And actually, right in line with that, Maryam, we were talking about how the pandemic is impacting cancer screenings. Can you speak to that, and can you speak to why something like iSono is so important in a critical time like this?
So during the early months of COVID, there was 90% plus drop in preventative cancer screening, breast, colon, et cetera. So, and as Kathy, Lydia, and Lonny mentioned, we had also planned to go to, clinic, hospitals, prove adoption, and then bring it to home, right? But that also, we've seen a shift in mindset of physicians and payers for the need to do more, self-monitoring and remote patient monitoring. So for us, we've been saying that from the beginning, but it's made it even more obvious, and the necessity of it has been obvious that if we can bring, this device to patients' home or very close to them, that they don't need to go to a hospital setting to do a routine breast cancer screening. We will be able to catch a lot of cancers earlier, which will not only save lives, obviously, but it will save a lot of costs down the line for payers, and make treatment, a lot easier and more effective. So, yeah, we've definitely seen this shift in the mindset of some physicians and payers who are saying, why would you need to do, for example, breast cancer screening at home, or outside, in a hospital setting. And now they're like, okay, when can you do this? When can you, when can we get there? So we've definitely seen that shift. And I think I definitely agree that now, as even more consumers that were not tech friendly are getting used to, having visits with their doctors over Zoom and over, Team and things like that, I don't think they want to go back after that, feeling that convenience. So I definitely think this is a trend that's here to stay, or at least the hybrid model that is definitely here to stay for the long term.
I would agree. So I'm going to pivot a little bit, it being Twin Cities Startup Week. I want to make sure we talk about advice for entrepreneurs and for people that are new to the digital health space. So Lydia, Kio has pivoted from a company that provided devices to a company focused on a digital solution. What advice do you have for companies that are pivoting, or just companies that are adding to their existing portfolio a digital solution?
Great question, Anna. So I'd like to talk about two pieces of advice. The first is to look carefully not only at market fit, but also at your business model. So digital health care is innovating in care delivery, and actually requires innovation in the business model as well. So as compared to, say, medical device sales, you really do need to look at not only who is your paying client, who is going to be purchasing you, but also does your business model align economic interests? Because obviously alignment of interests is an absolute must to have a successful business model, but alignment of interests in healthcare, I think we all unfortunately realize is neither simple nor supported specific to digital health by the traditional basic payment system. So you really do need to look at that. And then make it as simple as possible for your clients to adopt digital healthcare, right? So one thing that we did that was very significant was determine a method that a health plan or employer can actually pay for KEO through the claim system. So KEO can bill using 2 established CPT codes, and that makes adoption significantly easier for our clients because it keeps the cost of KEO off the income statement and also makes budgeting significantly more simple and reduces medical loss ratio, et cetera. So really think through your business model and be innovative in your business model. Look at utilization-based pricing, look at value-driven pricing, et cetera. The second, and I really think this differentiates companies who can become truly scalable enterprise digital health companies. And that's that, you know, you're not just creating an app. You're not doing something very simple. Healthcare is a very, very, very complex system. Kathy has already alluded to this. And you really, in digital healthcare, you need to accomplish 2 really challenging things simultaneously. The first is that you have to deliver an exceptional consumer experience. And so you're looking at your end user. If your end user includes physicians and nurses, you absolutely need to integrate into their workflows. For KEO, our main end user is the consumer. And so we need to deliver an exceptional consumer experience. We need to be intuitive, simple to use, engaging, fun, because we need to empower people and motivate people to do something that, quite frankly, people have lots of reasons to put off doing, right? To take care of your health. And so we need to engage people in that and empower people in that. So consumer centricity. And then simultaneously, you really need to deliver a robust, easy to implement, scalable solution, typically to really large enterprise clients. So this could be health insurance companies, this could be healthcare systems, this could be large employers. And these clients have very specific and often complicated needs. So when you're architecting your solution, and your solution is very likely going to include not just a consumer-facing app, but also you've got cloud-based, cloud-backed databases, you have web services, you have artificial intelligence, you have web portals, for example, and this entire solution that you are architecting really needs to think both about where you want to go long-term. Are you collecting the data and managing the data in the way that is going to meet your vision long-term and meet the needs of your clients? And then you need to enable large clients to have a level of customization while being standardized yourself. So a couple examples I could give. Security is probably the easiest. Even to launch a pilot in a healthcare system, you're going to need to meet rigorous security requirements. Within not too long, you're going to need to be certified in high trust, for example. So building that in from the ground up is important to think about. Scalability is also important to think about. And it's not just, you know, can consumers download your app? That's the simple part. It's, have you made your implementations with enterprise clients scalable? Have you made your account management scalable? And are you able to deliver an exceptional experience both to your enterprise business clients and to your consumer users simultaneously as you scale? And then what I call flexible standardization, meaning develop your architecture so that you have a robust standard product, but that product is nuanced and flexible enough to enable the customizations that your enterprise clients are inevitably going to demand, particularly provider systems and health plan systems, without you needing to do a lot of custom development work. And so we at KEO, for example, put a lot of thought into building in configurability points that enable us to spin up a very custom implementation very quickly with no custom development work in most instances. So just thinking through that whole architecture, and again, your business model needs to be innovative. You need to be delivering an outstanding consumer experience to the consumers in healthcare, the people using your solution, and you need to have architected to be able to meet the needs of enterprise clients in a very complex system.
Yeah, I think you make a really good point about consumer demand and how that looks in digital health specifically. So Lonny, you were an executive at Medtronic for 30 years. As a CEO of a digital health company now, how has your perspective changed and how is that different?
Yeah, in one headline, I believe more than ever that the democratization of healthcare is the future of healthcare. And what do I mean by that? So, just like we've seen in other industries, banking is an easy one to compare to, where we used to always go to a bank to do everything from the simplest cash a check to get some cash to actually have carrying around in my pocket. When I started, unfortunately, 30 years ago, that's what I did every Friday afternoon. And then technology happened, and now I don't know the last time I've been in a bank because I do all my banking through my phone. And the only time I'd go to the bank is if I have something serious enough to happen that I have to actually show up at a brick and mortar bank. And I think that's where we're going with healthcare is that, people will do very routine healthcare right in their phone and only go to a clinic when you need to. Now, of course, if you break your leg or you need a pacemaker implanted, you're going to go to a clinic or a hospital, right? But there's a lot of things where we waste the healthcare space through very routine things. And that's become clearer to me than ever when you get out and you start listening to all these brilliant people like we have on the panel here today that are doing things to what I call democratize healthcare and put healthcare back into people's hands more. And, I think the key to that is really having that consumer experience. And I'll know we're there when, as a person with diabetes, that I have essentially a doctor and a phone. And when I need something as routine done as renewing my insulin prescription, I don't have to leave work, make an appointment, go to a doctor, have that called into a pharmacy, and then drive to the pharmacy and pick it up. But instead, like DoorDash ordering food, my doctor in my phone basically says, yep, your insulin prescription is right. I hit okay. That goes to a pharmacy like Capsule, and Capsule delivers it to my doorstep in an hour. That's the way healthcare is going to work. And that's what I'm convinced of after getting out in the world.
Yeah, I think you're probably right, considering you look at every other industry today. So Maryam, another piece of advice for entrepreneurs, your technology is super intricate and novel. What can entrepreneurs do to show that they have something tangible enough to go raise money in order to actually make it a reality?
First, you got to make a working prototype, and it's hard, and hardware is tough because you need capital, right, to make a prototype, and then you need a prototype to go raise capital. So in the past couple of years, raising seed for medtech and digital health has become harder and harder. But yeah, so the way we did it is that we went to our accelerator, which helped us, and we raised money from angel investors who believed us who knew us from previous work, and colleagues and people who know us and believed in us, and that helped us put our first prototype together. And then once you have a working prototype, it becomes easier because then you can show that you have something that works. I think another thing that's super important is do your homework regarding your customer, and show that you have product market fit. And for that, you can do that by just getting out of the building and doing interviews with your potential customers and stakeholders, and especially as Lydia mentioned in healthcare, there's a lot of different stakeholders, right? So we interviewed end consumers, women, but we also talked to OBGYNs, radiologists, we talked to payers, so you need to go out and do that homework and show that bring a good case that you have product market fit, and there's somebody who's willing to pay for your product. So as a hardware company, especially when, it takes a lot of effort to develop the first prototype, and and also on the software side, it both takes a lot of time and effort. That's something that you can do, especially in the beginning. Go talk to people, make sure there are people who are actually interested in your product and is not, a technology searching for a market versus you're addressing an actual need. So that's my advice. And do your homework, know your numbers, and go talk to your stakeholders.
Yeah, get that elevator pitch down. So Kathy, I'd like to bring in your perspective as an investor with our final question before we open up to Q&A. What are investors focused on when a mobile app or a digital health company pitches to them?
Yeah, great question. I mean, it varies, right? Every company is different. Some are, they're going to really think about the business model, to Lydia's point about business model stakeholders, thinking about the interactions between the various stakeholders and how people get paid. So that is very, very key. I think what I tend to focus on things that are kind of clinically validated or need to be clinically validated as well. That's kind of my sector of where I think I spend time. So and then within that area, then there's a pretty substantial focus on what are you trying to say that you do, and how are you going to prove that you do it, and what does the FDA? What's the role of FDA in that? I actually prefer that there is a role for FDA typically, because it's harder, but it creates a barrier to entry for the rest of your competition as well. So I like FDA personally, and I think that so what I would be looking at is, do you understand what the FDA role is? Do you understand how to get through that process at FDA, and how are you validating what you're doing? And sometimes it's the FDA, clinical trial that is required, but more often it's that plus many other clinical studies of various sorts to prove to people that what you have works, what you have does economically what you say it's going to do, saves money, saves time, better outcome, all the things you might want to say. So when people come in and don't want to do those trials, that tends to me to be a pretty negative thing, typically, because I believe they need them, or generally I do, in their situation. So it's business model, it's route to market, right? Regulated or not. Does the team know how to do that? And then how are you going to prove it, and when? There are many other digital spaces that don't need those things, that you look at more business model and team and scalability. But I'm kind of coming in at that question from my perspective of the clinical side of that.
Yeah,
world.
That perspective of the FDA being a good thing because it's a barrier of entry for your other competitors. So we do have a question from the audience from Murtaza. So, Keo has a very interesting business model, and Lonny, I think Pops has a similar business model as well. Can you speak to how you landed at a benefit insurance route versus direct to consumer?
I can take it real quickly and then pass it to Lonny as well. Keo began selling to health insurance companies and then to employers. We've never been direct to consumer. A couple different things really quickly, and then I'm curious Lonny's thoughts as well. I believe it's significantly easier to go from being business to business than direct to consumer rather than the other way. Number one, because you have validated yourself clinically, you've been vetted by by healthcare systems, by health insurance companies. You've had to prove your clinical outcomes. You're not just a health app, right? So you've differentiated yourself that way. The barrier to entry, kind of Kathy's point, is significantly higher going that way. So you've differentiated yourself, and it's significantly harder to, in my opinion, to start direct to consumer and then come around and say, oh, well, we really are very clinically sound, et cetera. And similarly, with the architecture of the solution, significantly easier to architect for an enterprise client and then also sell direct to consumer than to go the other way. And then just philosophically, in our opinion, your health plan should be offering you digital solutions. You should not have to go and pay for these out of pocket. So we definitely believe in this type of solution being available to all people through their health plan or employer.
Yeah, quickly just add, I agree with what Lydia said. 2 reasons that we didn't go direct to consumer. One is we've trained ourselves as citizens not to have to pay for our health care. So to now go ask an individual, as much as I believe in consumer experience, say, oh, now you have to pay $30 a month for this. And they'll be like, what? I didn't have to pay for healthcare before. I got it from my employer. So it's really hard to convince people of that. And the second thing is it's just much more scalable to go through a health plan and have that be offered to 1 million participants than to go after every one of those individual 1 million participants yourself. That's a really hard marketing road to climb.
Yeah, and I would add you could still market directly to consumers so that they go to their physician or their provider and demand this offering, but the actual B2B business model makes sense from a revenue perspective. I just want to, we're kind of over time, so I want to thank all of our panelists. This has been a really wonderful discussion, and thank you to all the attendees and to Beta for putting on this event. I'm excited to see how your guys' companies continue to revolutionize healthcare. So thank you so much.
Thank you, everyone.
Thanks, guys.
Thank you.
Yeah, nice to meet you all.